Well, imagine if your most personal information was potentially exposed to the public. Our national investigative team found while hospitals struggled to combat COVID 19 in 2020, cyber criminals were infiltrating healthcare systems, demanding ransomware, and jeopardizing patient information. We have the breakdown on patient privacy, and we'll show you how tens of millions of people across the country may have had their medical records compromised.
We don't yet know how many patients have been affected.
When you see this kind of news report pop up on your TV screen,
but it's unclear when a hack might have occurred.
You may ask yourself,
knew they had been breached.
Is it me? Because if you're a victim of a medical data breach, your information becomes valuable. A treasure trove for cyber criminals. Our national investigative team discovered that over 800 healthcare breaches were reported to the U.S. Department of Health and Human Services in all of 2019, 2020, and part of 2021. 52 million people had their medical records compromised. Since the pandemic, the number of breaches has skyrocketed. In the first 8 months of this year, the numbers already surpassed all of 2020. And this year's numbers are 8 times higher than what was reported in 2019. Even though this impacts a lot of people nationwide, finding a victim to talk to for this story proved very difficult because they either didn't know about the breach or filed class action lawsuits with agreements prohibiting them from talking to us. But former hospital administrator Robert Goff did speak out. He faced 2 healthcare breaches after employees opened suspicious emails, forcing the hospital to pay millions to stop a ransomware attack.
That means that your operating system, your medical records, are not electronically available as you're providing patient care.
Goff said the hospital had the latest technology and security measures in place to prevent a hack, but it still happened, putting patient safety and treatment at risk.
Depending upon the hospital and the system, how fast can you get to your backup information and bring it online? It's generally not instant. There are some hospitals that indicate that clinical care was impeded and that there had been some fatalities.
Goff told us the hospital had no deaths, but he couldn't say if patient information ended up in the hands of cyber criminals. But the hospital staff is constantly training and re-educating employees on cyber attacks.
We do our own phishing attacks on ourselves. And unfortunately, if an employee has a habit of clicking on everything and does not change with education, we would be forced to terminate them.
Under HIPAA, healthcare organizations are required to report a breach to the Department of Health and Human Services, Office of Civil Rights, if more than 500 people are impacted. Our research shows the type of medical breaches tracked by the federal government. Out of 827, 3/4 of those breaches involved hacking. The 10 largest data breaches over the last year involved nearly 19 million records. We found the companies with the largest breaches include a corporation which administers government health insurance for kids and a major grocery company.
It's sad because look at all the people being victimized.
Right now, it's just the Wild West. There are no rules at all.
Texas Representative Michael McCall co-chairs the Congressional Cybersecurity Caucus, created 15 years ago to raise awareness of an evolving threat.
We have to have some rules of the game in the international space. The legislation I have on the Foreign Affairs Committee would set up this office within state, an ambassador that could negotiate with, say, our European partners, our NATO allies, that NATO is going to stand together.
Virginia Congresswoman Abigail Spanberger introduced the Better Cybercrimes Metric Act to help law enforcement go after hackers attacking victims nationwide. The bill hasn't passed. The protections we have in place, is it enough? Can we do more?
We can absolutely do more. Quite frequently, we'll see that companies or entities will pay whatever sort of extortion demand is made by these criminal groups or criminal entities.
The sooner the breach is contained, the lesser the damage will be.
Which is why cybersecurity expert Vahid Bezadon urges you to report any cybercrime and take steps to protect yourself by changing your passwords, getting antivirus protections, checking for computer updates, and reporting any weaknesses in the system. Should we worry about this?
All the time. you should worry about data compromises anytime that you provide or store information about yourself on the internet. You should be aware of the risk.
Now, according to the latest data breach report by IBM and the Ponemon Institute, the average data breach in the U.S. cost $9 million in 2021, with the healthcare industry paying the most per data breach. For Investigate TV, I'm Sandra Jones.